they sound like they come straight out of our health, our care, our say. Because Cambridgeshire County Council have that as their sort of mandate, really, and everything.
That's right.
It has to come under those 7.
Yeah, I think that's where they've come from, but not all authorities are adapting them. I think, again, they're so different in every area, but certainly Birmingham have. And when we had to apply for our carers services under the new third sector prospectus, and we had to follow all of these within that as well for the carers side of it.
I think they also come under transform and social care.
Yeah, yeah. So it's about, again, looking at those, isn't it? And, well, how do we show that we're meeting each of those was the big issue again, because we know it, but we've actually got to give them some tangible evidence that, yes, we are. A more detailed and accurate monitoring system. So we need to be able to make sure that we've got good systems so that we can produce this evidence and the proof of outcomes. So it's not just looking at the outputs, the amount of things that we're doing, but what has happened then as a result of what we're doing. That is just a little model that we've got, that we use, that shows the different stages that we look at, really. Initially, as you can see, there's obviously the data collection side of it, actually getting the information of who we've got, the different races, ages and that, in a system that you can pull it out and give it to someone as evidence. We have an inquiry line system where we deal with all referrals and the assessments. And again, that's part of this, making admissions quite smooth. We have person-centred planning and the programme at the initial stages, and we monitor the placement, and we have like 1 month probation, that type of thing. Then ongoing, we're looking at the outputs. And again, what numbers have we got? What number of hours are we delivering? What work have we done? So again, how are you measuring that? How do you know how many sessions of memory you've done? That type of thing. Do we record it? And again, this was something, when we looked at it, wasn't actually physically recorded anywhere. So we had to set up systems to start being able to just pull all of this out. The day-to-day monitoring of their work, how do we do it? And again, we sort of condense this down, if you like. We found we were doing a lot of things on the day-to-day sessions that, oh, they've worked on this today, and then you'd look back and there'd be reams and reams of paper, and you'd think, well, actually, how necessary is this? You know, how useful is this? And most of it wasn't. You know, it was just the workers had put the same thing, oh, I had a bad day today. And, you know, I think, well, this actually doesn't tell us anything. It's not really useful. So we condensed our day-to-day things down quite a lot to something really simple. And all we have now for our activity monitors is what they're specifically working on. So if they're, I don't know, in an education group, for example, and they're learning to read and write the alphabet from scratch again, then that's all they would have on their sheet, the aim. And then there would be steps of how we're breaking that down, and it would just be tick-dated in the comments of what they've achieved and when they've achieved it. And that's all we have. You know, we've really condensed it down, because it used to be like that thick for like a month's worth of work. And I think it's about just looking at your systems and just seeing, well, what do we really need and what we're trying to get out of this, really. What, you know, what can we get rid of? Assessment tools. We've introduced assessment tools in different areas that we've devised ourselves, just to give us some baselines, really, so we can look at when they started, they scored this, and now they're scoring that. And again, that's just quite useful for when you're looking at outcomes, because you can give them something that they can see. Obviously, feedback meetings is a day-to-day thing, and we also have key workers, and all our key workers work with a client for at least 2 hours every month, where they just sit and chat to them and check if there's any other issues or outside things that they need help with. And that's all logged as well. And then we're looking at the results, the outcomes, again, how we've made that difference, and it's about thinking how we're going to monitor that. We have an outcome tracker system, which probably some of you have seen the STAR system. Some of you even got something similar. I think I noticed on one of the posters somebody's selling that system now, which is great. And that sounds like a very similar system to what we use. And things like outcome records and personal goals. And I think those are the bits that are more important than what they're doing every day generally, and the same repetition bits that we record. And then we have an individual client record, which really is a record of their life with us, if you like, from day one, looking at even things like how their attendance has been every year, so we can see that they've attended well, what activities they've done when we change the programmes, all that type of thing, and their personal goals. There's a moving on strategy that we have, and then right the way through to an exit report at the end. We also have a monthly outcome form that all our staff use, and it's based on these 7 outcomes. And what we've done, we've taken each of those and looked at, well, what do we do? What will we achieve under each of those headings? For example, if we're looking at personal dignity, we might help someone be able to clean their teeth. We might help someone dress, all those type of things. So we list, you know, as a result of our work, X amount of people are now able to dress themselves, etc. So we list everything that we think we are honestly being able to achieve under those headings. The staff then just complete those individually across the month, and all that goes into a big spreadsheet. So all we have to do is press a button now, and under those 7 headings, when we have to do a quarterly report, I can just pull that out and it's there. You know, 5 people are now able to access this because of what we've done. It's there at the push of a button. Okay. This one is just really just to show you how we've split our activities. We've tried to put them under specific headings so that someone can come along and say, well, I want to buy an afternoon of core skills, or I want leisure and social activities. We're trying to define them a little bit more into specific packages, if you like. And then within each of our programmes there would be a selection of these according to what then people want to do. Okay. I think there's a copy of that in there anyway, so you can have a look when you've got a bit more time. Number 3, point 3, was funding the services in the future. And this is the big one, isn't it? We need to be able to cost each service and activity so that individuals can come along and purchase it. We still have a day rate, and we're still working on session rates. What sort of waylaid us a little bit is that we've had to change our tactics slightly as to how we're going to approach things, which I'll show you in a minute, but it sort of sent us off on another path now. So I think you think you're going in the right direction and you've got it all worked out, and then you find something else comes along.
What is your daily rate? What is your daily rate?
Our daily rate is 45. Yeah. New commissioning prospectus. I don't know if anyone else has had a new funding for... basically, this affected us with our carer services. We used to get money under a carers grant. That disappeared into mainstream funding. And they put out a new 3rd sector prospectus for funding, and we all had to reapply from scratch. That was nearly 2 years ago. We've been sort of running along on a shoestring. We thought we'd got it just before Christmas, and it was, yes, your bid has been successful. And then they decided that the process that was used for the bids was flawed. They stopped all the money and have been reviewing it for the last year. We just had a letter yesterday to say that, yes, we will get it now from March. So we're actually running on a 60 grand deficit this year. Don't put that on the table. No, I can't take it off now, can I? So yeah, you know, you think you're getting on top of things, you think you're getting things right, and as you know, things always come along and throw a spanner in the works. So we will